Welcome, everyone. My name is Jason Bivens, and I'm the Director of Business Development for Datamark. On behalf of the entire team and our many conference sponsors, I really want to welcome everyone to our opening keynote and our virtual public safety conference. We're really happy to have you guys here. Prior to joining Datamark about 2 years ago, I actually spent 10 years in executive leadership in 911 in large metropolitan counties, and really understand the challenge that 911 faces day to day, let alone in a crisis situation like we're experiencing now. And what I've found is that what makes our industry so special is the people that make it up, and the family that really we become a part of, a really larger piece of ourselves. And one of the things that we recognized about 10 days ago is that we see these conferences getting canceled, and I know it's a huge part of my life to continue to learn and collaborate and network with colleagues and friends. And so we wanted to be able to put something on for you in a virtual environment now that we're socially distancing ourselves, that we could still do that for you. So we have an amazing lineup of speakers and presenters this week on tons of educational topics across the whole public safety spectrum: GIS data management, well-being and self-care. We have the Lunch and Learn with Adam Tim from the Healthy Dispatcher tomorrow. And we have a keynote from Ricardo Martinez from Within the Trenches podcast on Friday. We have next generation 911 topics. One of the things I'm the most interested in learning about, and we're going to be talking about with Brian here in a minute, is how we're responding to this crisis situation in this unprecedented time of disaster that is coming up. And we have some speakers to also talk about that. We have Leadership in Crisis with Chris Carver from Hexagon Public Safety on Wednesday morning. And there's been a lot of talk about having to really fast track virtualization of 911 to respond. And so we're going to have some PSAP technology presenters also. Just a few quick housekeeping items before we get started. It's not too late to sign up for additional sessions. If you're interested, just go back to the registration page and you can click additional presenters and learn more about what options are out there. All the contact information for the presenters and their presentations will be made available via that web app. Presentation recordings are happening and will be published the week of April 6th on our YouTube channel, so stay tuned for that. And then finally, we are recording the keynote for future release on through YouTube on April 6th. So all the attendees have been muted for quality assurance purposes. If you have a question for Brian, at the bottom of your screen, you see a Q&A button. Just go ahead and open that and feel free to type any question you'd like. And we'll get to them at the end of the keynote. If we do wind up running out of time, we're going to record a post keynote session and we'll attach that to the recording when it comes up. All right, so without further ado, I am excited to introduce our first keynote speaker, Mr. Brian Fonce, who's the Chief Executive Officer of the National Emergency Number Association. We're going to have a conversation about the impacts the 911 profession is experiencing and how NENA can really support each of you from a frontline perspective. So before we get started, Brian, do you want to say a few words?
Sure. Thank you, Jason. I really appreciated your opening comments describing your experience in the executive levels of public safety and particularly in the world of 911. We truly are a family, and that you will see is a thread that's woven into a lot of discussions that are taking place, not only here in the US, but around the world. I think probably all of you are familiar with NENA, but if you're not, I'd just like to introduce you to NENA. I encourage you to go to our website, NENA.org, and on our website we have a resource page that we've been populating with a variety of links that go to wellness, that go to best practices, etc., in these unusual, amazing times that we're living in. And again, I encourage you to go and check that out. NENA is an organization representing over 15,000 911 professionals, both in the public safety sector and in the commercial industry sector. We are the only standards development organization dedicated solely to 911. And that'll enter into the conversation a little bit later. We're also involved in education outreach both internally to 911 and publicly in our communications with a multitude of media in the US and elsewhere in the world. And we also provide a number of certification programs involved in education. And certainly we are the leader, as I mentioned just a moment ago, in technical and operations standards development. We also have a very good government, I hate to use the word advocacy, I think of it's more of a government education program to help educate our national leaders, and certainly in some cases state and local leaders, as to the role and value of 911. So I also would like to say at this time, I appreciate all of the 911 professionals who themselves are finding their lives perhaps upended by the social distance requirements, kind of, as my brother described it, the couch arrest that we're all in. Many of our 911 professionals are those either single with children or married or with partners, et cetera. And when they're out of the home, taking care of the interests of the public at large, this places an untold burden on all of these professionals. So it's with a great deal of respect that I salute all of you for the work that you do. It's just a calling in many respects to serve the public. So thank you. And hopefully you'll learn a little bit more about NENA as we go through these discussions. And I look forward to our conversation.
Brian, thanks so much. I know NENA has been a huge part of my life as a 911 director and now moving into the private sector. And there's just so many valuable resources that you provide. And right now, as we're all keenly aware, there are so many things affecting our world in public safety and as 911 professionals, especially in the light of COVID-19, that's taxing what's already a stressed system in some cases. We all know NENA's put together a great set of COVID-19 resources for PSAPs to use. Can you talk a little bit about those resources and how they can be effective?
Sure. And again, I encourage everybody to go to our website and to look at these resources firsthand. And you'll see a variety of links. These links go to examples of what's taking place out there now in terms of how we are managing our 911 centers, relating to health and safety issues, as well as to ensure that there is no interruption in 911 calls. We're also seeing some activity in what I call the future of 911 actually taking place today, where folks are having discussions about virtual 911, looking at cloud technology, looking at virtual employees working from remote locations. And these types of bits of information and so much more is on that website. So I encourage you to take a look at it.
Awesome. And actually, we're going to do a live poll, which you'll see coming up here in just a second. For those of you that may have gone and used some of these resources already, if you could just click on what you think is the most valuable of them so far to you, just so that we can get some feedback on that.
Yeah, that would be helpful. I appreciate that.
And while they're voting, Brian, let's keep talking about COVID-19 and what do you think from a broader perspective the impacts are on the 911 profession? Can you give us some examples of what you're hearing from PSAPs today?
Sure. And just this morning, earlier this morning, we are part of a weekly call now with our colleagues in Europe, Canada, and Australia, basically comparing notes, information on best practices, and hopefully within about a week, you're going to see kind of a global collection of best practices that will be made available to folks throughout the world to help those situations that are already at the peak, those situations that are rising to the peak, et cetera, to better prepare themselves for it. Some of the things that I find quite interesting is how do you manage your 911 calls in your call centers? What are you doing for the health and wellness of your 911 professionals? I think it's just simply commonly accepted practice now, the restrictions and limitation of who has access to the floor at the center. Some centers are dividing their staff and putting part of the staff in a remote or secondary PSAP, and the other half in the primary PSAP as a means to kind of ensuring continuity of operations while trying to protect the health and safety of staff, which I think is a clever idea. Some are looking at a 2-week window where you take half the staff and they work for 2 weeks, meaning they're sleeping, eating at a facility, and then they're off for 2 weeks and then back on for 2 weeks. And I think there's probably very few facilities that are capable of that type of planning. The other aspects that are taking place now, just in our morning call this morning with the colleagues from different parts of the world, we were talking about the immediacy of the issues and the impacts on 911 centers. Concurrent with that, we're also taking a look at what does this mean post-COVID-19? And we're already collecting information in a post-COVID-19 world on issues that will need to be addressed, and to ensure the stability of 911 and public safety operations in general in a post-COVID-19 world. And these issues include certainly the connectivity to broadband services, the deployment of next generation, in our case in the US, 911 or 112 in Europe, or 000 in Australia. And they're already talking about how a next generation 911 environment may be able to assist in the movement of information and data among and between 911 centers in a more timely fashion. So both in the current environment and a future environment in a post-COVID world, we are engaging in those types of conversations, collecting information, and we'll be issuing documents kind of identifying those things that are current best practices and those things that need to be addressed post-COVID-19.
Great, and you actually kind of led right into the next question that I had for you, which we're seeing all this change, and we're having to change rapidly within our profession to respond to the ongoing situation. So do you think this is going to be a change agent to see NG911 speed up to full adoption more rapidly?
You know, I don't like to use crises as a springboard for things that I want, because it's the crises that's most important right now. And to me, it's the health and safety and the ability of our 911 professionals to serve the public. But nonetheless, it begs the question. And I've received that question from a variety of phone calls already. And I do think that as we do this post-COVID-19 analysis, you're going to see a greater emphasis on next generation 911. We were disappointed that the $2 trillion stimulus package did not include funding for next generation 911. But I'm led to believe that there will be another line item or another piece of legislation that will occur in the latter part of April that may address funding to some level for next generation 911. So I think you're going to hear more and more of the debate of next generation 911 and getting that deployed.
Good, because it's certainly something that's very necessary to move to our future state.
Yes.
Just to answer a question, for those of you that might not be seeing the poll, if you look toward the bottom of your screen, you should see a button that says poll, and that's where you can click on and answer the poll if you haven't already seen that. All right, so thinking about what you said about moving into a virtual environment and people needing to consider kind of that social distancing, even in the 911 centers, one of those operational questions is, how do we do that, and what impacts does it have? So when our call takers and dispatchers aren't physically present or close to one another, which they're used to, talking in the room and really enhances the 911 experience from a speed and an accuracy perspective. What are your thoughts about how to handle that as we move forward?
Yeah, I think we're only limited by our mental capabilities. And I do think that we will still have the capability in a virtual world, just as we are in right now, having the capabilities to interact with one another on a completely different note, but I use it only as an example. Yesterday, I attended a celebration of life memorial, and it was all done on Zoom. And it was amazing because you were able to fill that with video, photographs, and certainly people talking about the individual who had passed away. And even if we work in a virtual environment, nothing would stop us from having a Zoom or any other comparable program open so that you can communicate with your colleagues for that sense of community, that sense of family that you referenced at the very beginning. And so that's just one example of how we can utilize technology to enable us to still maintain some semblance to a physical being together in a 911 center environment.
And you're absolutely right. And one thing that I think is important is really thinking about how this is impacting the 911 professionals directly across the U.S. What would you say to them about how we can respond to this and how they can even help themselves through this period?
Somebody asked me it's over the weekend or toward the end of last week, what's your number one concern with COVID-19 and 911? And without even batting an eyelash, my number one concern is the health and safety of the 911 professional, first and foremost. And there are things that we can do, each of us, and there are things that can be done within the context of the center itself to help facilitate the safety and health of the 911 professionals. We all have directions and best tips, if you will, from either the Center for Disease Control or from other professionals at the state and local level that talk about the very things that we're existing in now, the social distancing, the hand washing, the hand sanitizers, and all of these things, wiping down equipment, wiping down doorknobs and cell phones and everything else. So all of these best practices are things that can be done to maintain the health and wellness of our 911 professional community. And I look at that as the number one thing. Without these 911 professionals, the breakdown in the chain of responses that the public is demanding now and will continue to demand becomes harmed. And so we are the vital link. One thing I found to be ironic and in some sense strange, the Bureau of Labor Statistics, what we've been looking to do is to reclassify 911 professionals as protected service. And that very agency issued a directive that classifies 911 professionals as protected services. So on the one hand, the same agency that refuses the clarification and upgrading of the 911 professional as protected services are now doing so in another document. And I think that as we go through all of this, we're going to find out either from the federal, state, or local level that we certainly are a protected service. Uh-oh, are you on mute?
Caught me that time. That's a huge step for us if we can get that accomplished as a profession. And I know there are a lot of states that are looking at that same legislation right now, aside from any federal movement. So as an association, you work directly with 911 professionals. You give lots of good education and conferences and webinars. How, in this period of time, how are you as an organization continuing to be a positive force in the public safety community while we're going through this time?
Thank you. This is uncharted waters for all of us. And, we've all lived through hurricanes, through earthquakes, through horrible fires. But this is truly a pandemic. It affects us all wherever we are in the world. And so as we chart these uncharted waters, we're trying to figure out those things that would best serve our membership in 911 writ large. And first and foremost, our resource page on our website is there. It's not perfect. We're constantly updating it, adding to it. And we also, for example, last week had a webinar on COVID-19, and our capacity was only 500 people that could watch it live, if you will. And we reached that capacity within the first few seconds of the webinar. we had a total of over 1,600 people registered for it. So I think there's a thirst, a desire to have a knowledge of what to do, what people are doing in the 911 community, kind of the shared experience. And we will continue to do these types of what I call outreaches and information sessions for our 911 professionals.
Awesome. And so this is an example of one thing that's happening now in a new world as a virtual conference. And so what's on my mind is, as we've seen the last couple of months of conference cancellations, is what are you, what's the conversation around the national conference in June? Do you have any update?
Well, at this point, we can only follow federal government, state government of California, and even more specifically, the city government of Long Beach. Right now, according to all of these authorities, they are still planning businesses as normal in the June timeframe. But who knows? Who knows what will happen? And so are we considering other options? Absolutely. But you know, right now we have to plan as if this were taking place in June.
Absolutely. And I know it's hard to really hear every voice. There's so many of us around the U.S. But I understand you put out a poll recently about 911 operations and their response to COVID-19. Can you tell us a little bit about the poll?
Yeah, we just released on. What's really weird about time is escaping me. What, you know, you work 7 days a week, and you know, it's just all a blur. So I believe it was last Thursday, if not Friday, we issued a poll, and we are currently receiving responses to the poll. In large part, what we're trying to find out is, you know, how is the call volume for 911 centers at this moment in time? Our goal is to have repeated surveys so we could do a longitudinal analysis of the impact of COVID-19 and the operations of 911 centers. We're also asking about what practices are being deployed in the 911 centers for health and wellness, as well as looking at opportunities to use unique capabilities to address the volume of 911 calls. In this case, whether it's a virtual PSAP or remote communications. And I know just in a suburb here of Washington, D.C., that some of their employees are testing that, experimenting with that. So these results hopefully will be at a sufficient level that we can report them out in the not too distant future. But it's a way of trying to keep a pulse on what is happening out there. Just this morning, one of the things that's just been really quite interesting, and I'm sure a number of our 911 professionals have experienced this, that there's been a drop in 911 calls. And
really, that's surprising to hear.
Yeah, I'm speaking generally now. Now, that's with the exception of New York and perhaps New Orleans and a few other hotspots in the country. But think about it. Businesses are closed, and people are basically social distancing by staying at home. There's very little traffic on the roadways. And I'm sure in major cities, what I'm about to tell you is the norm. We listen to the morning news report. We hear all of the roads that are closed or lanes that are closed because of accidents and so forth. It was last Tuesday, I was listening to the morning news, and there was one accident in the DC metro area that affected the closure of one lane. So that tells you the differences that are occurring. So because of that, I think we do see, and we would expect, a decrease in 911 calls. Now, just this morning, the mayor of New York mentioned in a press conference that they had a record number of EMS calls occurring within the last day. And I think that number was something like 6,000 calls on an average of a 4,000 call a day environment. And we're going to see that increase. It's kind of the quiet before the storm, certainly in the large urban areas. And so we just have to be prepared for that in all aspects of our life. So these are some of the unique trends right now. The other thing that we're anticipating is an increase in domestic related 911 calls. We just got a email a short while ago of a domestic shooting and drive-by shootings that occurred in location, not even in a major urban area. But we expect those types of calls. I mean, we're in close proximity to one another, or maybe cooped up in a house, and normally you might be able to talk things through. In other situations, you may resort to other means.
Yeah, I know I'm going a little crazy in these four walls myself, so I totally understand that. And someone made a comment that officers are also not making traffic stops. So I didn't really think about it, but that's another point of lessening volume by not having some of those routine things that happen day to day.
Yeah, what's really interesting, and I've heard that as well, about avoiding the routine police actions such as traffic stops. But I do find it interesting on some of the roads around here in lovely Alexandria, Virginia. They will have either a state highway patrol as you get onto the highway with just in a parked car, or a police officer, or those flashing signs to let you know how your speed is relative to the speed limit. And those are gentle reminders to comply with the law.
Yeah, for sure. So, a lot of what we were just talking about the last couple minutes have really kind of focused on a lot of the negative news related to COVID-19. And I think we all need to realize there's still a lot of positive stories out there. Do you have any insights on how our leaders can make sure that we keep people's minds at ease and find some joy as we go day to day through this?
Yeah, and I think you're absolutely right. There are positive stories, and the positive stories are typically related to people helping people. And that goes for the 911 professionals themselves. And it goes without saying that the normal course of life continues. So there'll be births, there'll be deaths, there'll be illnesses that are not COVID-19. And how we as a family of 911 professionals care for each other in those circumstances, I think are the uplifting stories. They're the same stories that exist previous to COVID-19, because we are a family. But I do think that in this world of COVID-19, that the extra care for one another becomes very apparent. There was just a discussion about this, was it on, I forget which news story, and it was all about the human factor in this, and the fact that when it's all said and done, humans are more inclined to help one another than to hurt one another. And when we're all under the same circumstances, not just those in the fire region or a hurricane or an earthquake, but we are all in this, and that we recognize that we have the opportunity to help one another.
Absolutely. All right, in the last couple minutes we have, the last question I had for you was, historically, in when PSAPs are in a struggle for either staffing, or they're in the middle of a crisis situation, they've been able to turn to the Telecommunicator Emergency Response Task Force, or TERT, as a lot of us refer to it as, for that support. But what we're experiencing now is something completely different, and maybe we don't want people from our center being exposed, and traveling. So how do you foresee us having to change our ability to support other jurisdictions when they have a need like this?
Yeah, I think that'll be a challenge, without a doubt. And I was just on a TERT call last week, and it was really quite interesting for the very reasons that you mentioned. The fact that, some centers do not want others to come into their center. Then this TERT team just talked about the idea of partnerships among and between 911 centers to comparable CAD equipment to be able to push and pull information among those who are on the same CAD systems. And it's kind of the ingenuity that is that comes to the forefront as people have to deal with unusual circumstances.
Well,
now,
that's one thing our profession has always been, is really intuitive and creative in responding.
Isn't that the truth? I mean, throw a problem at a 911 professional and it's likely to be solved.
Absolutely.
As simple as that.
Well, Brian, on behalf of Datamark and the 911 professionals that have joined us today, please, thank you so much for taking the time to talk to us, and Everybody get out there to NENA's website and check out the COVID-19 resources. We'll post a link to those so that you have it. Thanks again, Brian.
Thank you, and everyone be healthy and safe and help one another.
Have a great day.
Thank you.